Yes, welcome and thank you everyone for joining. I'm Dr. Sophia Wenzel. I'm a licensed clinical psychologist and also the clinical lead here at SkinPick. SkinPick is a therapist-assisted online program that can help you um, learn to cope with skin picking disorder. And today we're going to talk about emotional, or we call it experiential avoidance, and how avoiding our emotions can actually fuel skin picking, anxiety, and other mental health problems. Um, I'm gonna talk for about 40 minutes, and then we're gonna have a 20-minute Q&A session at the end where you can ask any question that might come up regarding the webinar or in general. I just want to encourage you to write those questions down in the Q&A section here in Zoom. Please don't raise your hands, just write the question down. You can even write down follow-up questions in the question set Q&A chat. I usually get to them. And also, just as a little encouragement, to stick around until the end. At the end of my part of the talking, I'm also going to have a little promo code for you in case you want to sign up to SkinPick, and that's going to give you a $100 discount on your first subscription. All right. So we're going to first of all talk about what we are avoiding, which is a little bit like, I mean, you already know it's our emotions, but I'm going to give you a few case examples of what that can actually look like. And then we're going to get into the why we actually do that. There's many reasons, although in the end it's not a good idea. Why our emotions are so important, how experiential or emotional avoidance can really, really backfire and cause a lot of problems. And then also what it means to actually, the alternative. What does it mean to really be in touch with your emotions? Then we're going to conclude and go to the Q&A section. Just checking. There's no questions so far, so I'm guessing you all can hear me well. That's always reassuring. Yeah, so we're going to talk about how we often tend to avoid feeling uncomfortable emotions and seek only for the comfortable, nice ones. That is a big topic. It's usually what lies at the root of a lot of problems that people present to therapy with, not only skin picking. And so I just want to give you a few examples of what that can actually look like. 3 examples. First of all, Leah. Leah has been picking at the skin on her arms and shoulders since high school. It usually starts in the evening when the house is quiet and her mind begins to race. She tells herself she's just fixing imperfections, tiny bumps, dry patches, but the sessions can last over an hour. Some days she doesn't even realize how much time has passed until she sees blood on her shirt sleeve or the pile of tissue beside her. Lately, she's been trying harder to stop, but every time she makes a mistake at work, every time a tense message from her mom comes in, every time she thinks about her next day at work in the evening, her fingers find their way back to the same familiar spots. And so this is the person that might present to therapy either here in the program or um, in practice with something, with a message like, I can't stop picking my skin. I need to break this habit, right? There's a behavior that I'm having problems with. However, at the root of it, there is something she is avoiding to feel, you know? In this specific example, I know skin picking is very complex in terms of how many different triggers there are. Sometimes it's habit, it can be boredom, but in this specific example, you clearly see that in situations in which she feels helpless, when she doesn't know what to do, when she feels inadequate, incompetent, anxious, those are the moments when she starts to pick her skin. So you could say, well, the problem I want to treat is the skin picking, but the skin picking comes from the place that she avoids feeling those emotions that are natural, normal emotions that we all go through, right? They're not comfortable, but we all know them. Another example. Daniel is a freelance graphic designer. Lately, he's been finding it hard to get out of bed in the mornings. He thinks about his tasks for the day, but then, without even noticing it happening, he starts scrolling through news articles he barely registers or lies on the couch with the TV on in the background. He avoids answering messages from friends, even though he misses them because he never knows what to say. He keeps thinking, what's the point? But pushes the thought away and takes another nap. The days blur together, and when someone asks how he's doing, he shrugs and says, I'm tired. And now Daniel might come to therapy saying something like, I need to learn to structure my day. I have those behaviors that are kind of addictive that I can't stop with my phone. I take way too many naps. That might be, the surface symptoms of what he perceives is his problem. But if you go a level deeper, you will see that Daniel numbs himself with, the watching TV, the scrolling down the phone, the sleeping. He numbs himself to avoid confronting deeper feelings that might be that he might be lonely sometimes, that he might feel inadequate, or that he's failing at his freelance job. And underneath this tiredness and the detachment, there might be something really painful that he's avoiding to feel. Last but not least, Maya is 23 and studying biology at university. Over the past year, she's been haunted by a thought that she might hurt someone she loves. She knows she doesn't want to. The idea makes her stomach turn, but the thought keeps coming back. She spends hours trying to remember exactly what she said or did during the day, making sure she didn't do anything in her definition wrong. Sometimes she prays in a specific order or repeats certain phrases in her head to neutralize the thoughts. She doesn't talk about it with anyone. She's afraid they'll think she's dangerous, but she keeps a list in her phone of things she's done that prove that she's a good person, just in case she forgets. Now, for those of you who know, that is an example of someone who suffers from OCD, most likely. And she might come into therapy saying, well, I have those thoughts and they're just ruining my life. I can not stop thinking those thoughts, but I don't want to think them. How can I make them go away? Right? But if you, again, try to understand, okay, what's behind the thoughts and why does she have such trouble specifically with those thoughts, then the thoughts and also or most more so the rituals, the compulsions that she will do in answer to the thoughts um, are what help her avoid the intense fear that she might be a bad person. You know, with the rituals that she then performs, she avoids the uncertainty of not having 100% proof that those thoughts are meaningless or that she might or might not have offended someone, without knowing. So what she is avoiding is the feeling of uncertainty and the guilt or shame or whatever feeling comes up when she considers not being a good person. So those are all examples of how people feel like some thoughts, some behaviors, some patterns, some inability to structure their days, um, are the problems that they work on. But then in therapy, often we realize, no, 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 no. There is some pain that we have to address, that we have to learn to cope with in different ways. And that's actually the answer. Um, there are many ways how you can avoid your emotions. And actually, our society, the way we live, is making it more and more easy to do that. Here are just some examples. Emotional eating can be a way to avoid emotions. Avoiding social situations that cause anxiety. Procrastination is a big one. Substance abuse, obviously. Oversleeping or napping too much, as in the example with Daniel. Denial, so just outright refusing to acknowledge or accept some part of reality. Distracting oneself, and this is the part where we just have more and more options to do it. A popular one would be to be on your phone, TV, but also excessive cleaning or working can be ways to distract yourself. Excessively checking things, as in the example with Maya. Surrounding yourself with people as much as possible so you're never alone with your thoughts or emotions. People pleasing as a way of avoiding feeling guilty or others being mad at me. Engaging in risky behaviors, again, to distract from emotions, self-harm, and excessively engaging in fantasizing or daydreaming. And in this list, you hear the word excessively a lot because that is the key point. It's very normal to sometimes be sad and distract yourself, with your phone a little bit, or to be anxious and clean the house top to bottom. Um, it's normal. You don't have to face all the negative emotions all the time. But if avoiding them becomes your default, and if those behaviors that you develop to avoid your behaviors become a problem in and of itself, then we're talking about something that needs, attention. Okay. Um, and when we're talking about like avoiding feeling an emotion, what is it actually that we are avoiding? What does it mean to feel an emotion? All of us intuitively know what it means to feel an emotion in the sense of we all have them and we've felt them, but it's hard. It's not such an easy question to describe, to answer if you're asked on the spot. My approach is that every emotion has three aspects to it that kind of make up the whole experience. Um, One of them are the thoughts that come with the emotion. So, for example, with Maya, the OCD example, she might have the thought of, what if I said something hurtful to my mom in our last conversation without noticing? So that would be what's happening in my head when I'm feeling the emotion. And then every emotion has some kind of physiological fingerprint, some kind of way that it manifests in the body. People might feel it differently, but actually there's even research that there are some common patterns. What you see here in the graph are people who are experience various emotions, and then you see in yellow to red activating patterns, and in bluish colors you see deactivation in the body. And we see clear patterns. So, for example, when Maya is asking herself, "What if I accidentally offended my mom?" and then she might feel anxious about it. Then you see in the lower row on the left the activation level of anxiety. So she might feel some kind of feeling in her chest area because there's a lot of activation, or she might feel um, ashamed. Shame, interestingly, you can literally see that there's a pattern of activation in your cheeks, like when you're blushing. Um, and so every emotion, you can feel it in the body, and it might feel different for every person. You might say, I have a lump in my throat. I feel like I'm choking. I feel heaviness on my chest. I feel tension in my hands, whatever it is. But there's also common patterns to it. And then finally, our emotions always kind of want to convince us to do something. So there's some action tendencies in an emotion. For example, if I'm mad, I might, want to yell at someone or kick something. It doesn't always mean that I do it, but there's some kind of, yeah, action tendency in every emotion. If I'm ashamed, I want to just vanish. I want to run away. I want people not to see me anymore. Um, And in Maya's example, she might want to apologize or gain certainty that she didn't offend anyone just to relieve her anxiety. Okay. Now the big question, why are we avoiding emotions, mostly negative emotions? I mean, a lot of us are not avoiding feeling happy or feeling love or loved. It's mostly the negative emotions that we're trying to not feel. And there are various very good reasons why we do that. So never feel bad about it, right? So first of all, negative emotions are uncomfortable. Um, we are biologically wired to react to our emotions, and emotions are designed to be warning signs that alert us to a certain emotional need. And a warning sign, just like a fire alarm, will not be a pleasant, nice melody. It's something that's supposed to grab your attention. And so it's in and of itself, oftentimes, yeah, just like an inner alarm that kind of takes all your attention for a moment. And just like hunger or pain, also uncomfortable physiological feelings alert to a physical need. So those emotions alert to a uh, psychological need or an emotional need. Also, emotions can be confusing, or sometimes they seem irrational to us. And that can be for various reasons. Sometimes we just don't know, like we can't give a name to it. Some people have lack emotional um, vocabulary, and it's really hard to face something when you can't even put a label on it. Sometimes it's just like, okay, something's going on. I can't even tell you what emotion it is. It just feels like a whirlwind. And then it's hard to know what to do with your emotion. Then sometimes it feels like or emotions are mixed or even conflicting. When I thought about that, I kind of remembered a client that I had. She was at that age where you kind of try to gain independence, her early 20s, not very successfully for various reasons. And she got in a lot of conflicts from her parents, with her parents, and sometimes her parents didn't give her the support that she would, or the freedom that she would need. And that was obvious, but for some reason she couldn't let herself, ever be angry at her parents, because she would say, how could I be mad at them? They love me after all, right? So this conflict, holding both truths of like, my parents love me, I love my parents back, but I'm also allowed to be mad at them, was something that for her was very hard to um, contain at the same time. And then another reason why our own emotions might seem confusing or irrational to us might be because our emotions were not taken seriously, or even invalidated when we were um, children, right? So sentences like, "Why are you being so sensitive? The other person didn't mean any harm. So why would you feel them? You don't have the right to feel your emotions if the other person didn't have um, bad intentions. How could you feel sad about this? Others have it so much worse. Be more grateful." There's a lot of sentences that many of us have heard in their childhood that make you feel like your emotion isn't valid, that you're not supposed to have this emotion, that this emotion is wrong. And that is also something that can lead to us avoiding them eventually. Um, Sometimes emotions can seem very overwhelming. Um, Either as a concept, if we learn in childhood, if our parents, when we were children, weren't able to cope with our emotions, they conveyed messages like, your emotions are too much, you are too much. Or if the child got the feeling of like, okay, my emotions make my parents sad or anxious or angry, then we can develop this concept of like our emotions are too powerful, they're too overwhelming, I have to contain them, I have to avoid them because they cause damage. Another reason why that can be is that parents couldn't contain their own emotions. So, in some kind of way of model learning, we would learn that emotions can be dangerous. For example, because when my dad or mom gets angry, that causes damage around them. So, anger should better be contained, for example. Sometimes an emotion can feel downright physically overwhelming because it does manifest physically. And for example, if you have fear that escalates to a panic attack, it can feel like you're going to faint or even die from the fear. That's how intense this emotion can feel. By the way, that usually doesn't happen. If you have panic attacks, you usually don't faint from a panic attack and certainly don't die from it unless you have a serious heart condition. Um, but it can feel that way. It can feel like you're going to lose control if you're very angry, or like you're never going to be happy again if you're very, very sad. So that can add to this kind of feeling of physical overwhelm. Obviously, if you lack regulation abilities, then your emotions can quickly feel out of control to you. And also, the definition of what overwhelming is. So if again in childhood you were confronted with messages of like emotions have to be under control, and if this kind of like amount of control you have to have over your emotions was exaggerated, then your emotions like on average might not even be that overwhelming, but because your standards of how well you have to control them are so high, you still might feel like they are too much. I had this client who constantly would say, like, I'm spiraling, I'm in a spiral, like I'm out of control, my emotions are taking over. And I was like, by what definition? Like at the same time, she was completely functioning, seeing her friends, working, advancing her career. Yes, she had some uncomfortable emotions and definitely some problems that we had to work on. But for her, it felt like a spiral, like a whirlwind, because she had, she had internalized the message that if you show emotions or if you're sensitive or if you cry, then that's a weakness, and that should be avoided. So that's why she felt like her emotions were overwhelming. Um, Lastly, and that is also a huge, like a very important message that I want to bring across. Um, or society really, really encourages us to neglect our negative emotions, to try to push them away and to invalidate them. And the more comfort, at least in the Western society, we reach, the worse it gets. So we have like this idea that a state of constant happiness, or that is achievable, or that you should constantly strive to be happy, in my opinion, is getting stronger and stronger. At the same time, the options to avoid your emotions, as I mentioned before, through various through your phone, or like all kinds of other options that we have now based on our technology, those options become easier and easier, and that's a really bad mix. And so some of those factors, for example, are commercials, selling happiness as a product outcome. So it's like if you're not feeling great, if you're sad, if you're angry, if you're anxious, that means you're missing something, and we can sell it to you at a certain price. And that implies also that happiness is the default, and bad feelings are errors that you can correct, but not normal, human experiences. Then obviously social media can oftentimes portray a selection of reality, not all of it, where kind of the implied message is everyone else is happy. Like, why aren't you? You should be happy too. Um, and then lastly, and that's something also that I experience a lot in therapy, that happiness is kind of like a personal responsibility. Like you're supposed to be happy, and if you're not doing that, then if you're not happy, then you're doing something wrong and you're failing. right? It means that you didn't manifest your wishes enough, or practice gratitude enough, or didn't meditate enough, or you don't have the right attitude. It's like you're not working hard enough at being happy. When obviously, yes, we want to strive to be happy. Yeah, everyone likes to be happy, but to feel like you're doing something wrong, or something is wrong about you, or shouldn't be that way when you feel negative emotions, that's a problem. We're all built, every person is built to feel the whole rainbow of emotions, all of them. They're all part of life. And when we push the negative emotions away, we're we're going to cause problems. And we're going to get to that. Okay, why are emotions important, even if it's hard to feel them? So first of all, we need our emotions for survival. Actually, we know from pretty amazing, very old research, psychology research, that, or maybe psychology, anthropology. We know that there are certain emotions that are universal, which means we find those emotions anywhere in every society, even if we go into some kind of jungle tribe that has never seen television, never been confronted with any kind of Western or else other culture, they will still smile when they're happy, um, open their eyes wide when they're scared, just like you see in those me pictures with actors that you might criticize or might not criticize. Um, and the one of the theories why emotions are universal is that they are part of our survival toolkit, that they have developed over thousands of years as part of evolution, as something that we need to survive. Um, and that makes a lot of sense. I mean, fear is supposed to take us, help us avoid danger. Anger is meant to help us set boundaries. So I like that theory. It makes a lot of sense to me. Then we need emotions to communicate. I recently read this thought that I really liked. It's like we learn to talk from age 2, approximately, right? But we express our emotions through facial expressions, through noises from birth, and that's important. Emotions create connection, and they help us communicate. And then finally, emotions are our connection to ourselves, right? Emotions provide valuable information about our own needs, desires. Um, they alarm us, as I mentioned before, like a fire alarm when something is wrong, when something needs to be done. And when we're not in touch with our emotions, we usually don't know what we want or what is right or not right for us. And there's quite a lot of people who have trouble accessing their own wants, their own motivations, and that really sucks. And it usually comes from them unlearning to connect to their emotions in childhood, and it's takes quite a lot of effort to relearn that. Okay. So what really happens when we avoid our emotions? We actually Now we talked about what emotional avoidance is, what it means to feel an emotion, why we avoid our emotions and why we shouldn't do it, like what is the value of emotions, but what actually um, happens when we do avoid our emotions. And for those of you who've attended previous webinars with me before, at some point I take out a cycle. At some point I will present you with a cycle. Everything is a cycle to CBT therapists. Um, and every cycle can be broken, fortunately. So when we talk about emotional avoidance, we say, okay, there's a trigger that creates an experience that is uncomfortable emotionally. We then want to avoid that experience, which creates relief in the short term and problems in the long term. And when we talk about how avoidance backfires, we're talking about how it can be problematic in the long term. It gives relief in the short term. That's the reason why we repeat those patterns, just like skin picking can be rewarding in the short term. The long-term problems is why we have to work on emotional avoidance when we go to therapy. So, for example, um, Leah, the one that suffers from skin picking, if we look at her cycle, we would see her triggers are when she makes a mistake at work, when she gets a tense message from her mom, or when she thinks about the next day at work in the evening. That for her creates an emotional experience of feeling anxious, insecure, or helpless. And because it's her, because skin picking is her emotional avoidance coping mechanism, it creates an urge that then results in the skin picking and the relief that we all know that comes after the picking. However, in the long run, she not only will feel feelings such as shame, guilt, or frustration, she also causes significant problems. For example, picking is consolidated more and more as her primary coping mechanism in those situations. She will not learn other ways to cope. She will not learn that she maybe is strong enough to stand this emotion or be in this feeling of the urge. She's not in touch with herself. She doesn't even know what, like oftentimes we don't even know what's going on. Why was I just picking for an hour? What happened to me? If we look at wow, I'm really bad with time. Okay, let's go over Daniel and then leave the other case example out just for time reasons. If we look at Daniel, then we would say a major trigger for him could be, for example, approaching a new task at work. His emotional experience would then be feelings of shame and inadequacy, and his coping mechanism is detachment. However, what happens, and this detachment feels nice in the short term, right? In the long run, he procrastinates, and he will maintain negative self-beliefs about himself. As like, I'm not getting shit done. I'm just I'm just pushing things away. I'm just distracting myself. I'm not advancing my business. Blah 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 blah. And what happens in the background is that he is actually not in touch with a significant part of himself, a vulnerable part, a part that is scared, that cares about things, that wants to succeed, that doesn't believe that he can. And this part of him, you might call it the vulnerable child, needs attending to. But as long as he's distracted, as long as he's detached, no one will get to this part and understand what are his needs. You know, what does he need? Maybe he needs structure. Maybe he needs help. Maybe he needs meaningful work. Maybe it's an affirmation. Maybe it's just someone to talk to. Um, but his detachment is leading him to go in the opposite direction, to consolidate his feelings of shame, his negative self-beliefs, and also socially isolate him. Right? So those are really serious issues. We'll skip that case example. So in general, what emotional avoidance does is you're missing out on life, right? If you avoid certain situations that make you feel bad, for example, social gatherings or taking risks at work, you miss out on meaningful opportunities in your social life, in your career life, and in general. If you don't listen to your internal experience, um, you're basically ignoring the alarm system, right? There might be a fire and you're not reacting to it. So you're not connected to yourself. You disconnect. Also, you by jumping to those emotional avoidance coping mechanisms that result in problems in the long run, you're stopping yourself from actually learning of how to healthily relate to your emotions, how to regulate your emotions. You can't do that if you, for example, pick every time a certain trigger feeling comes up. Also, you're making it worse. When you avoid negative emotions, it becomes harder over time to face them, right? Your negative emotions intensify. A good example for that would be for someone who has a phobia from spiders, someone who's very, very afraid from spiders, right? Their avoidance behavior will be to avoid spiders, obviously, but then they might start also avoiding basements in general. They might avoid going out at night for not maybe seeing the spider. Their fear might spread from spiders to other bugs or insects, right? So if you avoid something, your fear will usually grow. When you face negative emotions, it becomes easier over time to face them. And this all can lead to an increased risk of psychopathology. So emotional avoidance is usually involved when we're talking about BFRBs. That's why we have a whole session on emotional avoidance in our program. It's it's a very common problem, but also if we look at other disorders such as depression, anxiety, OCD, as we saw in the case example, PTSD, substance abuse disorders, um, I see it in almost every client that comes into my practice, no matter what the problem. Now, when we're talking about the alternative, don't think that the opposite, don't think that the intention of stopping avoiding your experience means to let emotions take over, right? That's not something that we want either. We don't want to be react to every emotion and react to every action tendency, as I mentioned before, that comes up. It's like if you're angry, you don't necessarily need to let that emotion take over and just yell at someone or punch them. What we're aiming at is allowing feelings to be present, but mindfully choosing how to respond. It's kind of you're the king of yourself or the queen of yourself or the president. And your emotions are your trusted advisor. It's so, so, so important to listen to their advice, to understand, okay, this is going on. And then you decide mindfully what you're going to do with that advice while connected with yourself. And I know I'm a little bit over time. I'm so sorry, but I really want to, I always strive to try to give you some practical technique or tool to take away. So I brought one today as well, basically to achieve this kind of like being in touch with your emotion, but also staying in control. There's different ways to get there, right? There's not one right way. Um, the basic idea is to increase your level of acceptance and ability to stay in a state of negative emotions and soothe yourself, learn to soothe yourself in healthy ways. You can do that through self-compassion based approaches, mindfulness. You can learn to express emotions through movement, through art, through communication. Um, some people find that soothing in nature. There's many different ways. The important part is that you have to practice it a lot. If right now you see, okay, in this list of ways to avoid your emotions, there are some things that I do excessively, that I do too much, or if you're here because you're skin picking, which would also be a way of avoiding your emotions in sometimes, then To practice some healthier way to approach negative emotions demands a lot of practice. It will take a lot of time. You will have to do it gradually. Sometimes some emotions might still be too overwhelming and you might, fall back into old patterns. That's okay. You just try again and again. You try it maybe with the easier situations in the beginning and then work your way upwards. Um, but in generally, in terms of your choice of strategy or approach, you have to find what's right for you. One strategy that I find really, really helpful that we use here at SkinPick is called RAIN. That's an abbreviation that I will explain to you later. But I think the best way to see whether that is something that you might profit from is just to quickly try it out with me here. So I actually want to invite you. Also gonna take a deep breath because I was hurrying through the last slides a little bit. I want to invite you to do this little exercise with me. It has elements of mindfulness and self-compassion. Just be open and curious, try it out. Try to close your eyes while you're doing it. I mean, your camera is off, nobody's seeing. You can be better in tune with your inner experience if you close your eyes. And let me walk you through it. If you get distracted on the way, if you get caught up in some kind of thought and then you notice and you're like, shit, I'm not doing the exercise, don't worry, that's absolutely normal and to be expected. Your job is only to notice and then try to come back to my voice and try to come back to the exercise, even if that happens many times. That's okay. Okay? So I want to invite you to find a comfortable position where you can sit with your back straight for a couple of minutes. Settle gently into this position, finding a balance between alertness and ease. Take a few deep breaths in through your nose and out through your mouth. Feel the breath entering and leaving your body, grounding you in the present moment. Now I want to encourage you to remember a moment when you felt overwhelmed, a moment of struggle. Might be a recent moment, something that happened today, or something that happened in the past few days. And let those difficult emotions you felt in that moment come up again, as if you were back in the situation. Sometimes it helps to go back into the situation as if you're building a scene in a movie and imagine where you were, what happened when this difficult emotion came up. So you can get in touch with your experience back then again. And as you continue to breathe, gently recognize what's going on, your emotions, thoughts, and sensations. Just notice them. Help to name what you're feeling. I'm feeling anxious, stuck, I'm feeling overwhelmed. Or maybe it's hard to find a name, but you can say how it feels in your body. Maybe there is a heaviness, tightness, or a restlessness. In a second step, allow whatever is coming up, whatever emotions, whatever thoughts, allow them to be there. Let it be as it is. You don't have to like what you feel. Just give it permission to exist without needing to fix or control it. Sometimes it can help to bring an inner yes to your experience. Yes, this is there. This is here. This is what I'm feeling. And that's okay. And a third step, I want you to investigate this moment a little bit more. Gently observe your experience with curiosity. Where do you feel this feeling in your body? In your chest, your stomach, your throat? Is it pressure, heat, tightness, tingling? What message does this emotion convey? What is it trying to tell you? What are you believing about yourself in this moment? And finally, as a fourth step, I want to invite you to offer kindness and compassion to yourself. Think to yourself right now, what I need the most is, and try to find an ending for that sentence. Try to talk to yourself like a person who really sees and loves you would talk to you. What would they say? Maybe something like, I care about you, I'm here for you. If you feel like you've messed up in some way, perhaps remind yourself that that's human, that everyone makes mistakes, that no one is perfect. Or being critical with yourself, tell yourself something like, give yourself a break. Or maybe you just need some acknowledgement, like, this is really hard, this really hurts. Sometimes it feels good to place a gentle hand over your heart or wherever you feel the emotion most strongly. Take a few more breaths in the space of self-kindness, being connected with yourself. And then when you feel ready, you can gently open your eyes again. I hope you enjoyed this little moment, being in touch with your emotions, even though those might be difficult emotions. I really love this method. RAIN basically stands for recognizing what is happening, allowing the experience to be exactly what it is. You're not exaggerating. You don't need to push it away or control it. Try to listen to what this emotion or experience is telling you, and then trying to identify some kind of need. Try to react to yourself with kindness, nurture. Not going to go through the steps in detail now. There's actually a lot of ways to read about this. There's a lot of little meditations on YouTube and in different places that can guide you through this meditation if you want to practice it. And as I mentioned, we have it in our program as well. Um, that's the end of my presentation for today. In conclusion, behind many psychological problems that patients present with for therapy lie uncomfortable emotions that we have trouble facing, right? Avoidance is a natural instinct. Emotions can be confusing, overwhelming, or even unacceptable. So I understand it. I absolutely understand why we want to avoid them. But oftentimes, my job as a therapist is to encourage and to try to help people to face those negative emotions, because experiential avoidance backfires. We miss out on life, we're disconnected from ourselves, we can't grow, and we might even develop serious psychological problems. The alternative is to allow feelings to be present without suppressing them, but choosing how to respond to them mindfully. And we can do that by practicing various techniques that can be mindfulness, self-compassion, or what we just did here. Want to remind you that we have a lot of free resources here at SkinPick, obviously the webinars, but also don't forget we have online forums, blog articles coming out every month. We're present on also channels of social media. Those are excellent places to find community and to get information. If you do want to sign up for SkinPick, then I have the promo code for you here, webinar 100, that will give you a $100 discount on your first subscription. Thank you for bearing with me, everyone who is still here. I will now to try to answer some questions. I see we already have some in the Q&A section. And if you didn't get to write your question down, then you can do that now. Okay, let's see. I got the diagnosis of dissociation identity disorder, but was misdiagnosed for over 10 years. Skin picking has been with me since the age of around 11. I guess that the skin picking is related to the emotions I repressed as a child from early age on, and fragmented myself into different identities to handle my emotions. Is there a specific therapy approach that also considers the connection of dissociation identity disorder and skin picking? Thank you. Ooh, well, dissociation identity disorders is not an easy diagnosis, and like, I don't want to, I don't want to justify it, but I can understand it's difficult to correctly diagnose, and like, I'm sorry that it took such a long time for you to get the right definition for what you're suffering from. Actually, all kinds of dissociative disorders are quite common amongst skin picking, and skin picking can be a tool to repress emotions that your system feels overwhelmed with. There is not a specific therapy approach that I know of that considers the connection of dissociation identity disorder and skin picking. I know that our therapists here, many of them are very adept at treating different kinds of dissociation. Basically, what you're looking for is, a therapist who is experienced with dissociative disorders and also knows how to do habit reversal training, which is the most effective way to treat skin picking, to kind of gently and slowly allow you to let go of unhealthy ways to regulate your emotions, and again, in a very gradual, very gentle way, be in touch with emotions. But I mean, in your case, even you would need someone who is also experienced with trauma, would be my guess. So yeah, I think it's less about the approach, more about the therapist that you feel comfortable with and that has the right expertise. Okay, that's a very short question. About tears when sad, go ahead and cry or stop. I am all for crying. I like that question. I am so pro crying. I recently read, I have to mention, I read that on social media, not in an actual research article, but I read that tears contain cortisol, stress hormones, and that the crying releases you of stress. Now, again, I didn't check the research behind that, but I very well believe that because there's so much relief. And crying, in my opinion, is a healthy emotion regulation technique. I sometimes do it on purpose. I know exactly which songs I have to put on so I can have a good cry and then get it out of my system, get some catharsis, some relief. So always go ahead and cry, never stop. I mean, like there are certain situations in which you can't cry, but usually if you have the privacy and the comfort of a place where you can cry, then do it. Um, Another question. Anger from others triggers me. I realize people have a right to their anger, but it scares me due to anger from others. When others are angry at me, that triggers me. I realize people have a right to their anger, but it scares me due to childhood experiences. Any tips on how to handle? Thank you. Great question. When others are angry at you, that is triggering. It's triggering for a lot of people. You're definitely not alone. Um, if you have experience in your childhood where anger from others, specifically from your main caregivers, made you feel um, unsafe, where you were constantly struggling on avoiding that, on pleasing the people that took care of you, then anger can become a really triggering feeling. However, if you avoid others being angry at you at all costs, then that means usually patterns such as people pleasing, um, avoiding conflict, avoiding confrontation, and that can cause a lot of troubles in your personal life. It can cause troubles at work, but also in relationships. When we avoid conflict, we have the sense of like we're saving the relationship, we're avoiding the fight. Fighting is not good, but actually fighting is something really healthy in a relationship, right? So so what I would want for you would be to find a gradual step-by-step way in which you find ways to take risks, to do things that you fear might make other people angry. Start with very easy situations. That depends on you and you know what your specific triggers are. Sometimes it's I don't know, just ordering something in a restaurant and then complaining about it to a person that you don't know. There's different examples, and practice that and consider facing other people's anger, or sometimes it's not even really facing their anger, it's just doing something that you're afraid that might make them angry, right? Consider this ability like a muscle, and consider like if it's a real strong trigger for you, then your muscle right now is very weak. So you start with really low intensity exercises and then work your way up to the heavier weights. And it's very, very hard to do, right? But it's so rewarding, right? If you avoid other people being angry at you at all costs, then you are really limiting your life and you're disconnected from yourself and your own needs. Um, I see a raised hand. Please write down your question in the Q&A section. Instead, can you recommend any good books on emotions? I think that question is a little bit too broad. There's many good books on emotions. It would depend on what you want to learn. Also, I'm not sure I'm the best source of book recommendations in general. Um, I feel like at this age, you would probably at this age, not my age, like this or time that we live in right now, um, over the internet, or dare I say, ChatGPT, you might find um, a more thorough way of looking at all the literature and books that exist, so and specifying your question and then getting results. Yeah, that was a really long answer to a very simple question. Sorry. Just don't feel like, obviously I read books, but like um there's so much out there right now, specifically in the field of emotion regulation, how to cope with emotions of your child, how to cope with trauma, where emotions come from. There's so much out there, so much to be read. And for me to say, I know this is the book for me, I feel like I would overestimate uh, my abilities. Also, my way of like, because they're really like, and I get so many recommendations of also of what to read. And then sometimes um, I just start, first of all, following the author on social media, and then I see a few clips and I see whether their message convinces me, and whether I'm interested, and then I actually, go over to reading the whole book. But that's just like how I do it. Um, okay, we're actually a little bit over time. Thank you so much for your insightful questions, for being here, for sticking through this very long monologue of mine. Um, I really hope I'm going to see you again for the next webinar. Thank you for the emojis. I saw all of them. They make me really happy. And yeah, I hope I'm going to see you again for the next webinar, and I hope you're going to have a wonderful rest of your day. Thank you.